Luke Brocco was doing some yard work at his home in Penticton when, without realizing it, he was about to become part of history at Kelowna General Hospital.
It's just this year that I really noticed that there was problems as far as not being able to mow the lawn without getting a little bit of short of breath and stuff like that. Originally I thought it was just getting a little bit older, so it kind of hit me by quite a surprise.
Brocco needed quadruple bypass surgery, and instead of going to Vancouver or Victoria, he became the first ever open heart surgery patient at KGH.
We did the bypass surgery on him. So on the left side, you have sort of the diagram of what the bypass circulation does with a picture of the aorta. On the right, you have sort of the artist's renditions of what happens when the patient is on bypass. So he had that artery from the right and an artery from the left with two connections and a vein. Before, at least on the cardiac side, the very sick patients, they would be transferred to the coast. Now they stay here. So that has increased the acuity quite a bit. Also, the new technology that we've brought in, it will help many other services like oncology, trauma, ICU.
For families, the opportunity to receive this type of surgery close to home is a welcome relief. The drive, hotels, costs, and worries associated with going to the Lower Mainland will now be eliminated for Okanagan residents.
It makes it so much easier for my wife as far as not having to stay in a hotel or whatever down there. Well, for me being there, it probably wouldn't have made that big of a difference while you're actually in the hospital, but the fact that you can get out and be home within a little more than an hour, that made a lot to me, and plus she was driving back and forth every day too.
I remember when I was a GP in Rossland, in Trail, and our patients would have to travel so far for things that were urgent. To be able to do that here, right in Kelowna, is just fantastic.
Already, the surgeons have been busy since the first operation on December 3rd.
We did different surgery every day. On a Tuesday, we did an aortic valve. On the Wednesday, a mitral valve repair. On a Thursday, we did a ASD, a hole in the heart. On the Friday, we did a beating heart without going on bypass. And on Sunday afternoon, we did an emergency from CCU, a patient that was at risk of sudden death from a type of lesions, and he was developing a heart attack. And then since Monday, we've been doing 2 cases a day. The only thing we won't be doing is a transplant and a pediatric cardiac.
The hospital expects to ramp up to around 600 procedures a year, about 3 a day by April. The surgeries are taking place in 2 renovated operating rooms at KGH while the interior heart and surgical center is being constructed. The 54-year-old Brocco is still a bit sore, but he's recovering on schedule.
It's still a little difficult getting out of bed, and tying shoes is a little bit difficult, but other than that, I feel pretty good, yeah.